Immunity. Essentially, that means you can't get the virus again. I'm Dr. Bradshaw. We had a recent question from an online viewer. The question, once someone gets the virus, can they get it again? The short answer is no, they can't. Once you get coronavirus and fully recover, you're free to run around the country without a care in the world, at least from this COVID-19. In fact, in some countries like Canada, doctors are willing to give you a certificate that says you have immunity for when you are traveling internationally. The other way to get immunity is from a vaccine, a vaccination. A vaccine, unfortunately, is probably a year away, give or take. So, how does immunity work? Immunity is a complex process that I'm going to make very simple. So, immunity, way number one, the hard way. You get the disease, the coronavirus, COVID-19, and in the healing process, your body's battle with the disease, your body recognizes the disease, the virus, as a foreign body. Foreign body, the key word body. So foreign body. And your body creates antibodies, which attach to the virus, the foreign body. These antibodies that you have created that attach to the virus, that your system itself has made, that attach to the virus, it's like then a red flag to your immune system, these antibodies, telling your body, here it is, come and get it, come and kill it. These antibodies attached to the virus help your other cells, such as macrophages, one of your immune warriors, track down, kill, and eat the virus, making you better. Once you are better, your immune system now, because this event has occurred, it has a memory of this particular virus. It has a memory in the form of extremely small numbers of immune warriors floating around in your body, in your system, that will recognize the virus if it comes back. So if it comes back, if you're exposed again, your immune system is immediately alerted and goes into hyperdrive to kill the virus, to make lymphocytes, more antibodies, specific immune warriors that know how to kill this virus and kill the virus before it can even take off. Nip it in the bud, if you will. Think of it this way, with this war analogy. Your body has soldiers, immune soldiers, ready to fight a battle for you, fight off foreign enemies, infections. But when this virus shows up, your body has never seen anything like this before. Your immune soldiers don't recognize this virus as an enemy. It's like your immune soldiers were asleep, and by the time they wake up and realize what's going on, the enemy is through the perimeter, over the wall, and all throughout the city. Fortunately for most of us, we still win the war. Now, after you recover, when the virus tries to attack again, next week, next year, whenever, now your body is more ready. This time, your immune soldiers on the outer perimeter recognize the enemy immediately, and they call immediately for reinforcements. And boom, the virus is dead. The virus is killed. Okay, immunity the second way, number two. Immunity the easy way, a vaccine, vaccination. So it's really the same process in a way as the first way we talked about, but the vaccine, what it does is the vaccine is an injection of dead viruses into your body. Or if it's an attenuated vaccine, attenuated viruses, meaning not completely dead, but almost dead, enough so that it can't replicate, can't hurt you, and your immune system will kill it. Your immune system, seeing these dead or nearly dead viruses, goes into the same action, same thing. But instead of fighting a live virus, it's fighting a dead virus. So obviously you're going to win. Or a near dead virus, if it's attenuated vaccine, and you should still win. Your immune system gets activated, just like in the first example, and now has a memory of the virus, so that when it shows up again, your immune warriors recognize it as the enemy. They call for reinforcements immediately, and boom, this virus, this new attack, they're killed. The viruses are killed. Now, some people ask, can the vaccine give you the virus? Well, if it's a dead vaccine, dead virus, no, it's dead. No way, no how. What about if it's an attenuated vaccine or almost dead? No, it can't give you the virus except if you are severely immunocompromised or if the virus was not fully attenuated enough, that is, the lab screwed up, which rarely happens in modern medicine, but it did in the old days. Let's cover this last exception a little bit more in detail and another really important exception. So, and there are exceptions, even with immunity, whether it's immunity number 1 or 2 with the attenuated vaccine that we discussed a moment ago. There are exceptions. So here's another example. Suppose someone has their immune system completely wiped out. Maybe someone, God forbid, end-stage AIDS, or someone who's had a bone marrow transplant and it's at the worst, most critical part of the bone marrow transplant where the immune system is almost wiped out. Because you have essentially no immune system, the immune warriors aren't there to recognize the enemy, and therefore they can't call out the reinforcements. And quite frankly, even if they could call out for them, you don't have any because your immune system has been wiped out because of the AIDS or the bone marrow transplant or things like that for severely immunocompromised patients. On this same point, if the vaccine is developed and it's an attenuated one, not fully dead, the immune compromised person could still potentially get the disease, because even though the disease is near dead, it's not completely. And if you don't have much of an immune system, it's still possible it could overpower it. But for most of us, no problem. And for most of us, you get the virus, you get immunity. You get the vaccine, you get immunity. One last point of an exception, and this is an important one: mutation. COVID-19 can, and actually has been, there are studies that are showing it now, it's evolving, it mutates. It can eventually become a different virus. Different enough that you can get the disease, but in a certain circumstance, if it mutates, it's really a little bit different of a virus. You could get that newer one, you could say get it again, but actually you're getting a new one. It's a mutated version of it. So even if it's mutated though, hopefully your system will fight it off better and it will be less deadly because it has recognized a little bit from the prior COVID-19, even though it's a little bit different. And that's the problem with the current COVID-19. Almost all of us, our bodies have never seen anything like this before, ever. So our immune systems are totally out to lunch when this thing hits. Thank you for watching. Stay healthy, and we'll have some more videos explaining more details about how to stay healthy and how things are developing. Thank you.